Medicare for all, because healthcare is a right. Medicare for all, time the U.S. saw the light. That the best healthcare plan is a single payer plan. Now's the time to finally put it on the table. Medicare for all, because healthcare is a right. Medicare for all, time the U.S. saw the light. That every woman, child and man should have healthcare in this land. Now's the time to finally put it on the table. Now's the time to finally put it on the table.
Imagine all the people living for today. Imagine there's no countries. They say I'm a dreamer, but I am not the only one. Well, I hope someday you'll join us, and the world will live as one. As one, as one. Imagine no possessions. I wonder if you can. No need for greed or hunger, a brotherhood of man, and a resistance made of women.
What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. Sounds good. We are here at the federal building because our senators, Senator Murray and Senator Cantwell, have not, to my knowledge, taken a strong position.
Medicare for all.
Medicare for all.
Medicare for all.
Everybody in.
Everybody in.
Nobody out.
Nobody out.
Medicare for all.
Medicare for all.
Everybody in.
Everybody in.
Nobody out. How many indivisibles do we have here today? Raise your hand. For some reason, seem to find a lot of teachers at these events. So thank you all, and I hope you're enjoying your summer, your much-needed summer vacation.
Good, yeah, thank you.
Who wants Medicare for all?
We do!
When do you want it?
Now!
Who wants HR 676, improved and expanded Medicare for all?
We do!
When do you want it?
Now!
Both the ORRA and the Better Care and Reconciliation Act would eviscerate protections against discrimination for pre-existing conditions and eliminate the requirements for essential health benefits. That means prescription drugs, that means mental health services, that means medical devices, and that means so much more. With the looming prospect of the decimation of our healthcare system, more and more Americans are realizing that there is a better way. According to a Pew Research Center survey conducted in June, a full 60% of Americans contend that the federal government has a responsibility to ensure health coverage for all, including 2/3 of adults under the age of 30. We the people realize that the only morally just nation is the one that provides health care for the vulnerable, the poor, the disabled, the elderly in nursing homes, the chronically ill, the prematurely born children, and all Americans.
Woo!
Thus, we are here today with an unequivocal message to our representatives. Pass HR 676. Speaking for myself, I demand Medicare for all, but cover dental, cover vision. I demand everybody in, nobody out. Say it with me. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. I demand copay-free care with a dearth of deleterious deductibles. With improved and expanded Medicare for all, we get all that and more. No more for-profit insurance companies sucking every cent from the most vulnerable for medically necessary care. I want to tell you a personal story about why improved and expanded Medicare for all single-payer health care is so important to me. The sad reality of my chronic illness and my medication discovered that the most daunting hurdle to my health, besides the illnesses themselves, were the for-profit insurance companies, whose preeminent goal was to do whatever they could to cover as little as possible. After 13 years of chronic illness, I finally decided that now is the time to demand universal health coverage for every man, woman, and child. Woo! With the looming destruction of our healthcare system, now is the time to declare that we must adopt national improved Medicare for all, so that the poor and middle class, as well as the rich, can get access to the most cutting-edge medications, treatments, and therapies. Now is the time to join the rest of the industrialized world and to make single-payer a reality in the United States. Thank you!
We're going to be fighting back to make sure that we can protect the health care that is under threat right now. And it's not just the Affordable Care Act. It's Medicaid and Medicare, the trifecta. Because the Republicans and the conservatives have had their eyes set on undermining these critical health care programs for far too long. They want to privatize. They want to voucherize. They want to rip away our health care to even get more profits out of us. Are we going to let that happen? No! Hell no! Not only are we fighting to protect those programs, but we're fighting now to take advantage of the crisis that the Republicans have caused and push for health care for all. House Resolution 676. Woo! Woo! But we got to continue to hold folks accountable. Every single House and Senate member needs to continue to hear from us. The only reason that Representative Jamie Herrera Butler and Representative Reichert voted no the first time, or said that they would vote no, is because you guys held them accountable. So we must continue to hold them accountable, take advantage of this crisis, and continue to educate people about the need for House Resolution 676 for Medicare for all, because we will not slow down. We will not take one step back. We're not going to check the box after round 1 and 2 because we know that they're going to keep coming, and we will continue to fight for health care as the human right that it truly is. If you want to join the coalition, we will be there in solidarity with you. We have a toolkit that provides all the details you need. Some of the folks in this audience actually created that toolkit. It's a document that can help educate people about the need to fight back on the trifecta: Medicaid, Medicare, and the Affordable Care Act, but also realize there's far too many people that are being left out, that are falling through the cracks. They can't afford it now, so we have to take that second step. If you want that toolkit, let us know. Toolkit to do 3 things. Number 1, educate our own community about the need for House Resolution 676. Number 2, educate our own community organizations about the need to take this into their communities. And number 3, and most importantly, get every single Washington State Congressional member signed on to House Resolution 676. Are you guys ready to help with that? Yes! All right. So when our health care is under attack, what do? Stand up, fight back. When our health care is under attack, what do?
Stand up, fight back.
When our health care is under attack, what do?
Stand up, fight back.
Woo! I'll be there standing with you. Thank you guys for everything you do. Go indivisible.
Tactic of socialized medicine whenever we get into discussions of health reform like we're doing now.
See the stuff that I saw in the United States of America, which is probably more akin to Sierra Leone than the U.S. in South Carolina's case. You get sick in New Zealand, your doctor visit, there is a copay. I hate to say it, it was a point of contention, but after that, drugs, $2. Lab work, free. X-rays, free. ER, free. Hospitalization, rehab, free. Paid for. By your taxes, by everybody. Everyone was in. We can do better. We can do that.
Healthcare is a human right. We need to keep people alive. HR 676 will save lives. Who's for HR 676? HR 676. As a physician, I can say the amount of extra work imposed on us by insurance companies is overwhelming. Many of us are leaving, not because we don't want to see patients, but we can't deal with the industrial complex called healthcare at this moment in the United States. There are 3 major players: Aetna, Humana, and United. Locally, we have the Blues, but we need to get rid of those players. Their goal is to make money. Our goal is to get health care. We need HR 676. HR 676. A friend of mine has had cancer and was told by her doctor to go and get treatment. She got treatment, not thinking about it. Her fear and everything just forced her to get treatment. The bill she got was $200,000. Premier refused to pay because they said she went to an institution that wasn't in their HMO plan. We can't let for-profit insurance companies run our lives. We need health care for all. Health care for all is the only way to go. Medicare currently takes 2% in overhead. Insurance companies take 30%, 17% for advertising, to whom, and 13% to pay middle managers and their executives. We need to end this steal of money. The $350 billion we could save over 10 years could be used to give us all health care. Yeah. We all deserve health care. Yeah. Health care for all.
Yeah. We all have trauma, right? Life is traumatic by its very nature, and we all live in these incredibly vulnerable, fragile bodies, and we all get sick. And everything that is happening, whether it is this fight to take health care away from us, or whether it's police violence against people of color, or whether it is Islamophobia, all of this, what it comes down to is a hatred of our own vulnerability. And we need to start respecting that each and every one of us has individual human worth, and we need to create a society that believes that. This is a long haul fight, so take care of yourselves, take care of each other, rest when you need to. We got a long road to go, but we can do this. I believe we can do this. Thank you.
I worked for 25 years in community clinics, Country Doctor and International District Community Clinic. While I was working at PacMed on the Hill. So that was a wonderful experience, except for all the disasters I saw coming in basically every day for people who delayed coming to receive health care because of financial problems. Because of the disaster that's going on in Washington, D.C., the daily tweets and messages, breaking news coming out every day, if not every hour, there's been unprecedented attention focused on our goal of health care for everyone, and we are closer now than we ever have been.
Yeah!
However, the key to making this real is the understanding we will not move in the direction of health care as a human right for all until we replace our private insurance market-based system with one dedicated to health care as a human right and guaranteeing health care for all our residents. And as you folks know, that's Medicare for all. Everybody in, nobody out. Dedicated Progressives has spent the last few months battling to protect Obamacare status quo against attacks from the right. But with the likely death of the Republican efforts to overhaul the healthcare system, space is opening up, and we need to shift the focus to what's next. Preserving the ACA is not enough. The time has come for universal health care through a single public health insurer that covers everyone in our country, and that is Medicare for all. Yes! In the course of defending the good parts of the ACA, progressives have made the moral argument about the brutal effect of people's lives of not having health insurance. Every member of Congress who votes for these Republican bills is willing to stand by as thousands of Americans die of preventable deaths.
Yeah!
But that argument also renders our current system indefensible. Then how do we justify sticking with the ACA, which now still leaves 30 million uninsured and more than 20,000 deaths every year? Medicare for all will save $600 billion a year, enough to cover everyone living in the United States with all necessary care, without premiums, deductibles, and co-pays. And you can have any provider you choose.
Yeah!
Thank you so much for coming. And do not fail to reach out to your Republican people in love and in care and give them the information we've got hanging all over here, because we have to do this together as a nation. It's people against the man.
I want to thank you all for having come here. Pam and I are so grateful and so indebted to all these different organizations that have come together. I just wanted to say, you know, our Constitution guarantees life, liberty, and the pursuit of happiness. Well, life is hard if you're dead due to some illness, and you certainly can't pursue happiness unless you have some modicum of health. And I don't consider it just a human right. I consider it a civil right. Just as much a civil right as our right to be here speaking freely to one another. Medicare for all, no one left out, everybody in, no one out.
Because healthcare is a right, Medicare for all. Shine the U.S. saw the light that every woman, child, and man should have healthcare in this land. Now's the time to finally put it on the table. Now's the time to finally put it on the table.